Was it a good call today, do you think, by the WA Premier Mark McGowan to cancel plans for the Royal Show to go ahead and also delay the further easing of restrictions in your home state?
Yes, absolutely. I think that everyone's starting to learn we need to be very humble in the face of what's going on in Victoria. The difficulty of controlling even small community outbreaks in New South Wales makes us reflect that now's not the time to be getting hundreds of thousands of people together, a lot of it in crowded indoor venues, and it's going to be, I think, a relief to the community in many ways. Everyone understands why this is happening.
And when we talk about community attitudes in some of these states where there isn't community transmission at the moment, how confident are you that those states will be able to continue on in that state of security and safeness indefinitely? I mean, are you of the view that clusters really could just pop out at any moment, or are you confident that the measures in place are safely going to safeguard really the people who are in some of those states?
We know that there's going to be outbreaks and clusters in every state eventually. It's very unlikely that we'll all get through to vaccination, although that would be great without seeing any sort of outbreaks again in our communities. That would set us apart from the rest of the world, really. And New Zealand's experience, I think, of over 100 days with no community spread and suddenly back where they are now, makes it very clear that none of us are immune, literally, and won't be surprised at all when we see it pop up. It's, do we have in place the capacity to deal with it? Is our aged care set up for it? Are our hospitals set up for it? Are our general practices set up for it? And I think the answer is probably no. We're not ready yet.
And why not? Why aren't we ready after so many months of preparations?
I think the bureaucrats and those in charge have been rightly praised for managing to control this through border control and travel restriction, and the community's rightly to be praised for having socially distanced and done the right thing by not gathering together in large groups. But in the meantime, a lot of the work around having adequate PPE for the front line hasn't been done. GPs don't have access to respirator masks that are fit tested anywhere in the country pretty much, nor do a lot of the hospital workers. And now we're seeing healthcare workers being affected at 3 to 4 times the rate of the general population in Victoria, and that's because they've stuffed up workplace safety. They haven't got it right. So we have to respectfully learn from what's happened in those workplaces where it's intolerable. You can't have people who are supposed to be looking after the community getting infected, or what happens is your aged care facilities fall over, as they've done there, and then they take down with them the hospitals if they're not ready. They're still crowded, stagnant places that don't give people access to top-line PPE, and it's unacceptable. It's got to be fixed.
How is morale among health workers right around the country? I know you're in contact with a lot of them in terms of looking at why we're continuing to see so many health workers contracting coronavirus in Victoria. The levels must be quite disheartening still for particularly the Victorian workers.
Well, healthcare workers are determined not to sit back and just be told that, look, this is the policy that's come from the National Committee and they're the experts. They're not the experts in our job. We're the experts in our job. We need occupational medicine specialists. We need occupational hygienists to be going through our workplace and doing what they do, which is making sure that the workplaces are safe, because whilst we've had a lot of input from infection control, they're about keeping patients safe from infection, not workers. And we've had a lot of input from infectious diseases physicians and epidemiologists who are rightly experts in their field, but this disease has only been around for 9 months. The science around how it spreads is not settled. And we're now looking at huge numbers of infected healthcare workers, which is completely unacceptable, and not only for those workers, but also for the people that they're supposed to be trying to look after. We had a whole ICU shut down that couldn't be used simply because we don't have the right risk controls in place yet.
Have you been shocked at the findings we've been learning about the aged care sector and how that's been managing or mismanaging, as the case might be, the pandemic generally?
Look, I think in general the community is probably shocked and disappointed. I'm not so much, because I was following the Aged Care Royal Commission pretty closely, and we sort of grow up thinking that the adults are in charge and they'll have this under control, whereas in fact we never had aged care under control. The standards have not been high enough. There's been a lot of good people trying hard, and I don't want to throw the baby out with the bathwater. There are good facilities, but overall the they're facilities that are providing hotel services. They're not suitable for large numbers of very unwell people, and the things that the Aged Care Royal Commission were grappling with were only just starting to be addressed. So I'm not surprised at all at the horrific crash of that into the big bureaucracy of the states trying to deal with a sector they've never really dealt with. State governments haven't had much to do at all with aged care. Our Health Minister has just had his first ever meeting with the aged care providers in our state. So there is no effective plan in place for when the staff at those locations don't turn up. And why would those staff turn up, quite frankly, if they're all being pilloried for being undertrained? Well, they are the lowest paid workers in the sector, so of course they don't have the training that matches the others. They're terribly understaffed, they're terribly overworked, they're going between different facilities, and they're not being given adequate PPE because there's a belief that they probably don't need it. Well, that's turned out to be not true. We need to rebuild it and rebuild it quickly. And we need to open up the data as well, and governments, unfortunately, of course, want to control the flow of information, but we need more data. So in Victoria, let's start by being completely open about where people are infected and how it happened.
When it comes to those staff moving between aged care facilities, would you like to see other states starting to take on some of those measures that we've seen implemented in Victoria to stop aged care staff working between various facilities as a sort of prevention method?
Well, I think the hot tip is that aged care staff are doing everything they can to find jobs in anything but aged care. So the problem's going to be getting people who are willing to go to work there. They don't want to put their families on the line whilst being paid just over minimum wage for looking after huge numbers of high acuity patients. And who can blame them? So I think certainly providing the resource and the incentive at a state level to ensure that these people don't all suddenly turn up in your hospital, these residents getting admitted to your hospital, hundreds of them a day, and make your state hospitals fall over. Sure, it's a Commonwealth problem, the aged care sector, but the Commonwealth don't have any staff to provide. The Commonwealth don't have any skills to provide. They've got money. So get the money from the Commonwealth now and get some proper support into the aged care homes where there are no outbreaks yet. Because if you don't deal with the vast majority of the places where there is no outbreak, then pretty quickly you can, within a few days, have a situation where the very low-paid staff are going to go, look, we love the people we look after, but this isn't worth it, and we know this is only headed in one direction. So let's fix it now and fix the hospitals, get the proper levels of risk management into the hospitals with occupational medicine experts, not just infectious disease people.
Plenty of those issues being considered right now, right around the country. Dr. Andrew Miller, the WA AMA President, appreciate you joining us.